Hi everyone, Dr. Ruiz here. So recently I had the lovely experience of having my 1.5-year-old twins come to the office. And I was wondering if I had waited so long to bring them in, maybe there's parents out there that don't know when they should or if they even have to bring their kids to the dentist. So I wanted to talk about baby's first dental experience. The American Dental Association, or the ADA, recommends to start good oral hygiene habits even before the first tooth peeks through the gums, and their first dental visit 6 months after their first tooth comes in. On their first dental visit, we will talk to you, the parent, about how to take care of their teeth, answer questions on the eruption patterns, what to do and not to do, and any questions you might have about pacifiers or maybe habits like thumb sucking. We will also help your child to get familiar with us and try to make it the most pleasant and fun experience for them. The hygienist will see your child first and introduce them to the instruments we will use. Depending on your child's age, she will brush your teeth with a toothbrush or polish them. And then the dentist will come in and examine their teeth. It's definitely something new for them, so sometimes your child might get a little bold.
Let's count your teeth.
But don't worry, we will make sure that we're taking extra good care of them with the most tender loving care that we can give them. We will hope to see you soon.